showing fibrocystic changes only because the mammographer did not have a high level of suspicion for malignancy. Nothing further was done. In 1997, patient presented with the right supraclavicular lymphadenopathy and a lymph node biopsy showed metastatic breast carcinoma, GCDFP-15 plus stroke ERP plus whatever it means. The lesion in the right breast was now larger and radiographically atypical. Excision of it showed invasive ductal carcinoma. When recuts were prepared to another medical center, a focus of invasive carcinoma was seen that had not been represented in the original slide. So this was underreporting. 41-year-old man presented with rapidly worsening, I'm so sorry, abdominal pain and was found by abdominal MRI scan to have thickened bowel segment ileocecal junction, underwent laparotomy, resection of the intestine. Because of presence of transmural chronic inflammation, fibrosis in the bowel wall, diagnosis of Crohn's disease was made. Despite treatment with steroids, patient had recurrent abdominal pain and weight loss and was found 9 months later to have a huge retroperitoneal mass. Biopsy established diagnosis of large cell lymphoma and retrospective review of the original bowel resection disclosed tumor in that specimen as well. The patient died 3 months later. 35-year-old woman had 4 centimeter irregularly pigmented lesion in skin of the left leg, and they took a punch biopsy, interpreted as a compound nevus. Patient was told it's benign, need not be excised. When the mass enlarged, began to bleed 11 months later. Patient saw another dermatologist who did a complete excision, and it was obvious melanoma in vertical growth with a breast floor depth of 4.1 mm associated with the compound nevus. Woman subsequently manifested metastasis in the brain and died 2 years later. Pathologist was sued, but not the first dermatologist. Okay. And similarly, FNA examination, I won't read it. It's again something which is, it was a fibroadenoma and diagnosed as a malignant, which was later on excision not proved to be the case. There was 24-year-old man with painless mass in right Achilles tendon with enlarged over 6-month period, fine needle aspiration, interpreted as pigmented villonodular tenosynovitis. No therapy recommended. 8 months later, mass increased, showed a clear cell sarcoma, and patient died of pulmonary metastasis subsequently. Okay. Similarly, lung cancer, I won't say they did some bronchial brushing later and washing, and then that was interpreted as a squamous histoplasmoma, and subsequently there were problems. Okay. Now, let me tell you that needless to say that all these cases were followed by litigation. The relatives, patient claimed a lot of compensation, and which was awarded in some cases and not awarded in some cases. Now, I'd like you to just talk about this case in a little bit detail. It happened in Indore, city of Indore, and the Bombay, 2 pathologists from Bombay were also involved. So please permit me to tell you this case a little bit in detail. This pertained to a 5-year, this is a very interesting case, so I'd like to tell you in detail. This was a 5.5-year-old boy shown to orthopedic surgeon for pain in the left shoulder. X-ray was taken and a diagnosis of acute osteomyelitis was made. Post, the surgeon decided to operate. He opened the area and he curated the whole thing. There was no pus, but he felt it was a cyst. And they did curating of the cyst was done. He did curating of the cyst, but somehow he was little suspicious, though there was no other soft tissue mass. And he sent this for histopathology to 3 pathologists. Can you believe it? He sent it to 3 different pathologists. He was suspicious. I don't know why he sent to 3 pathologists. The first pathologist said, suggestive of aneurysmal bone cyst. query, osteoclastoma. Please interpret in light of clinical and X-ray findings. No evidence of malignancy seen in section studied. This was pathologist number 1. Pathologist 2 said, solitary cyst of humerus, no evidence of malignancy. Pathologist 3 said, query aneurysmal bone cyst, no evidence of malignancy. Now, as if this was not enough, pathologist number 3, her colleague was in USA, Mayo Clinic. So she sent the slide to Mayo Clinic now. Mayo Clinic to this Dr. Unni, some Dr. Unni in Mayo Clinic, her colleague. And he said, Mayo Clinic said, aneurysmal bone cyst. All right? So now we have 4 pathologists saying there is no malignancy. 2 months later, this boy got recurrence of the swelling. And he went to the orthopedic surgeon again. And orthopedic surgeon said, no, don't worry, there's some inflammation, there's that, maybe infection, gave antibiotics and said, we'll get an X-ray done, if necessary, re-biopsy or whatever. But they never came to him again. They never went to him again. They went to another orthopedic surgeon who referred him to a cancer surgeon in Indore. And that cancer surgeon said, no, this is malignant, this is not benign. And he referred the patient to Bombay Tata Hospital, to these surgeons here. So those slides were sent, and these slides, the Tata Hospital pathologists, they reviewed the slides, and what did they say? Sorry, I must also tell you that these 4 pathologists, they said non-neoplastic, and then the 4th pathologist, professor of pathology in that medical college, presented that paper in a conference like this to all the pathologists, right? And and the topic of the subject was non-neoplastic lesions of bone, a slide seminar. All right? So this was presented in a conference like this, and everybody appreciated, clapped and everything. All right? Now Tata Hospital said, cellular tumor rich in osteoclast giant cells, pleomorphism plus few mitotic figures, taking into consideration histological findings and X-ray picture diagnosis of osteogenic sarcoma is favored. The diagnosis is favored. They also did not say very clearly, you know. And there is increased vascularity. The child had to undergo a 4-quarter amputation, was done at Tata Hospital. And now they filed a case in the National Commission at Delhi claiming 30 lakh rupees as damages. This was 96, mind you. 30 lakhs, then what was the value? In 1996, claimed 30 lakh rupees. And this case went on, and all the pathologists gave their opinion, and a lot of literature was shown that how an aneurysmal bone cyst can look, or rather the osteogenic sarcoma can easily be mistaken for an aneurysmal bone cyst. And 4 pathologists said, so obviously all couldn't have been incompetent. And even USA, the doctor said, and this case went on for many years. And then, of course, I lost track of it. Though the doctors had met me, we had discussed. And then, but it was a very old case. So I also, somehow I got the telephone number of, there were 5 doctors. So one doctor, orthopedic surgeon, they said passed away 2 years ago. So I could talk to him. The pathologist, I could speak to him. So I said, what happened after that? I didn't know. So they said, no, the court finally exonerated them. They were not made to pay compensation because, and of course, one charge was why alkaline phosphatase was not done at that time. That was another allegation. Why you did not do alkaline phosphatase? Told the surgeon was told why you did not do. And he said that can rise in so many cases, and even osteomyelitis, it can go up. So, so somehow they gave lot of references, lot of textbooks, and somehow they were exonerated. All right. So the message is also, if at all there is any allegation, you need to study it very well as if you are writing a thesis, and you have to convince the court, which is not so easy, because they are all lay persons, they don't know anything, but they are supposed to become medical experts, and which is very, very dangerous thing, but that is what is happening, you can't do anything. Sorry. And the next case, again, which I would like to tell you a little bit more about it, again a very interesting case, occurred long back. This was from Dhulia, pathologist from Dhulia, very, very busy pathologist, and some lady, pregnant lady, came to him for VDRL, routine testing, including VDRL. So what did he say? His report was that VDRL is positive. He said this pregnant lady, and her husband was a lawyer, by the way, Husband was a lawyer, and he said VDRL is weak positive, 1 in 2 dilution. With a footnote, weak positive may be non-specific. And, I'm sorry. He said VDRL test positive, titer 1 in 8. And this he typed in red. In those days, it was in red. Positive report means highlighting. So in red, 1 in 8 positive. And then, of course, she took injection Penidure and whatnot from other doctors. And husband, of course, then they got it done from 2 other pathologists. One said 1 in 2 dilution, weak positive. Other said weak positive may be non-specific. Same thing, the other pathologist also said the same thing. So they said no. And this fellow said, they filed a case against this pathologist and said that the husband threw out the wife. Husband threw the wife out of his house. You are of loose character. Your VDRL is positive. And, but then it turned out to be negative. And there was a big litigation. For several years it went on. And at the end, the judge, he said, yes, you are guilty. Patient has suffered. So, but fortunately in those days, they were not so generous. So he said, opposite part, the pathologist shall pay 50,000 plus cost of 10,000 to the complainant within 2 months. Otherwise 18% interest and so on. But what he said was that the defendant, and he gave lot of literature that how it can be false negative, But the judge said, though he has produced lot of things to support his contention, we agree that the literature does support his story. However, it is a fact that the report stated VDRL positive for titer 1 in 8, which could mean either the wife or the husband could be suffering from venereal disease, and hence heavy dose of penicillin was administered. However, now this is the key thing I'd like the message to give you. However, in the certificate issued by the doctor, there is not the slightest indication that the result should be treated as a preliminary result subject to confirmatory test. There is no iota to show that the results were in the nature of preliminary result and further confirmatory test should be carried out to resolve the diagnosis. We feel this is a serious deficiency on the part of the doctor, and in view of the stigma and social